and welcome to Feeding Forward, ABM's conversations across continents on breastfeeding medicine. This is a special series from the Academy of Breastfeeding Medicine in recognition of World Breastfeeding Week. I'm Nicole Wallace, the Executive Director of the Academy of Breastfeeding Medicine, and I'll be your host for this global storytelling series. Each year, World Breastfeeding Week unites individuals, communities, and organizations worldwide in celebration of the vital role breastfeeding plays in the health and well-being of families. This year's theme, Prioritize Breastfeeding, highlights the importance of creating sustainable support systems for breastfeeding families. In this series, we're taking you on a journey through 5 countries: Japan, New Zealand, the United Kingdom, Mexico, and the United States, to explore what breastfeeding medicine looks like in diverse settings, systems, and cultures. These aren't formal presentations, they're open, reflective conversations with ABM members who generously share their experiences, challenges, and insights as clinicians, advocates, and members of their communities. Today, I'm honored to be joined by Dr. Tomoko Seo, a general pediatrician who has been practicing for more than 40 years in Okazaki, near Nagoya, in the Midland region of Japan. Dr. Seo has been a dedicated member of the Academy of Breastfeeding Medicine since 1999 and attended her first ABM member meeting in Vancouver in 2002. An experience she describes as finding a place where she truly belongs in her professional journey. From 2003 to 2009, she served on the ABM Board of Directors, notably as the first board member based outside of the United States. Today, she continues to care for families in a local private clinic, working alongside an IBCLC pediatrician and an IBCLC midwives. At home, she shares her life with her husband, a retired physiologist, and their beloved Shiba Inu. I'm so pleased to welcome Dr. Seo to Feeding Forward. Thank you for joining us. Let's dive into the conversation.
Thank you for inviting me as a speaker.
Absolutely, absolutely. So, seeing that this is a global conversation, why don't we just start with our time differences? So, what time is it for you now in Midland, part of Japan?
It's 2 p.m. on Saturday afternoon.
So it's 2 p.m. for you on a Saturday afternoon, and it is 12 a.m. for me on a Saturday morning.
I know.
Which is beautiful. The wonderful part of how technology brings us together globally. So this is just a really wonderful opportunity for us all. So why don't we get started with our first question, which really I want to hear from you, Dr. Sale, about the overview of breastfeeding in your region. How would you describe the practice of breastfeeding medicine where you are?
Breastfeeding medicine is not recognized as a subspecialty of medicine in Japan. However, some pediatricians and OBGYN are very interested in breastfeeding. But traditionally, breastfeeding support was done by midwives in Japan. So Japan has a very long story of long history of midwives who are taking care of prenatal and postpartum mothers, and usually physicians considered that breastfeeding support is a job for midwives. But in Japanese medical system, midwives cannot prescribe medicine, and they can open their own private clinic, but their practice is not covered by insurance. So as a physician, I can practice breastfeeding medicine by insurance. So it is much cheaper for the mothers to come to my clinic. And usually in private practice by midwives are expensive because it is not covered by insurance.
So, as a practicing physician and providing breastfeeding support, you're able to provide it covered in by insurance care for patients. Now, given that, is there any regulation around breastfeeding support in patient care in your practice in your countries?
No, I
What
don't think
involves
so.
the government?
Yeah, and it is within the usual ordinary medical practice. So it's not a very it's not a um, special thing, but it is within the scope of everyday practice in medicine.
So it's part of normal treatment, but not
Yeah. Yeah.
necessarily that specialized part of
Yes.
care.
So
So
when mother with mastitis come to me, and I can prescribe medicine, and I can support them by correcting their breastfeeding position or baby's latch, but they are all covered by insurance. So no special fee, but I can prescribe medicine, and this practice is covered by insurance.
So how does your patients know that I'm having a breastfeeding problem? I need a special someone who knowledgeable in breastfeeding or breastfeeding medicine.
Yes, and some mothers come to me um, when they search on the internet. And on in my clinic there is our website, and we provide breastfeeding medicine. And midwives in my region knows about me very well. And if the mother come to the midwives, and the midwife thinks it is beyond their scope, such as mastitis needs some medication, and they send the mothers to me.
It's interesting. I had a very similar experience breastfeeding my two children
Mm.
and finding support, not necessarily, and this was many years ago, of course, but not having a direct physician or knowing exactly who to go to for support, but starting with a lactation consultant who then directed me to a physician for care. So it sounds like it's really a multidisciplinary support system to provide the care to the mothers and families that need your support so vitally.
Mm.
Now, when we talk about, you talked about midwives and kind of the support that they're providing. Um, it sounds like are 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 there lactation consultants in your area, or is it mostly the midwives and then the physicians?
Yes, in Japan, 90% of IBCLCs are midwives, and nearly 10 to 13% of IBCLCs are physicians. And some midwives are not IBCLCs, but they provide breastfeeding care. And IBCLC midwives knows me because I'm very famous among my IBCLCs in Japan. So they send their some mothers that need some medical practice. They refer them to me.
Now, are there any initiatives or goals to have breastfeeding medicine recognized as a specialty in Japan?
No, um, when I was interested in breastfeeding, I first became an IBCLC because there's no way to learn about breastfeeding support in Japan. And I am one of the very first IBCLCs in Japan. And at that time, I need to learn by English textbooks, and I need to take examination in English. So in the beginning, and the first IBCLCs are mostly physicians. Then the examination is was translated into Japanese, and we made textbooks in Japanese. So now 90% of IBCLCs are midwives. And there are, I think, 900 IBCLCs in Japan.
Wow. I'm guessing you played a big part in the 900 IBCLCs in
So, yes, and me and my colleagues um, worked very hard to provide education about breastfeeding.
That's wonderful. You host a conference
Yes,
as well.
yes, and I was the president of Japanese Association of Lactation Consultants many years ago. And in the beginning, there was a conference to provide breastfeeding education to all kind of healthcare professionals. And since 20 years ago, we also have another conference for physicians only to provide breastfeeding information exclusive to the physicians who should know. So I think this year we have a 20th conference in Japan. And that
Wow.
conference is endorsed by ABM for many years.
And about how many physicians typically attend that conference?
Usually 100.
That's wonderful. Wow. That's a great network. That's amazing. And that really kind of serves as the core support and training and education of
Mm.
the physicians in Japan, I imagine. That's wonderful. That's wonderful. I think your introduction could have been a little bit longer. We added a lot of these things.
Yes.
Um, so what are the common, from a cultural aspect, how is breastfeeding itself viewed culturally in Japan?
It used to be a very natural, normal custom breastfeeding in Japan. It used to be. But now young mothers do not think breastfeeding as a natural way. And it's a big issue. The breastfeeding rate is decreasing in Japan very quickly recent years because there is no policy to support breastfeeding from the government. And then there's no national policy to support breastfeeding or promote breastfeeding. And um, new mothers think exclusive breastfeeding is too much work for them, and so they want to share their um, feeling with the husband. So they want to their husbands to feed the baby with a bottle, and so the so many mothers wants to feed breastfeeding and bottle feeding. So that's why the breastfeeding rate is very quickly decreasing.
Is that um more of a social it's interesting that you've had this shift where it was natural and now it's declining.
Yeah.
And is that, I guess I'm wondering, is that just the generational change in perspective
Oh
or
yes, there's a generation. Um, the the way of thinking is quite different, and young people do not know about the natural way of human because we are mammals and animals feed their babies with breast milk, but they do not just they do not know lack of knowledge about the natural mammal behavior. So, and nobody tells them the importance of breastfeeding. And um, so, well, so people should provide um, the natural way of living as a mammal.
Mhm.
But now the circumstance is very it's not natural, it's artificial. So they want to control their life in the way they want to. But the natural physiology cannot change as a human. But they are not aware of what the natural human behavior.
It's really interesting to hear you say that part about natural human behavior and mammals. Um, During the ABM conference last year in Schaumburg, Illinois, and Chicago in
Mm.
the United States, one of our attendees, who I believe she was from traveling to our conference from China, she visited one of our local zoos while here, and she was very appalled to see a display. She was in the monkey exhibit, and they had a display showing how the monkeys, the mammals, feed their babies through breastfeeding. So there was the sign of showing them feeding their babies through breastfeeding, and then they had human people feeding their babies through bottles, and that was the display in the zoo. And so of course that was very appalling, and we had a some great conversation around educating our local zoo here about the fact of the natural makeup of our bodies and how babies should be fed. And it was just, so it's really interesting to hear you say that perspective of younger moms in Japan. It's interesting how there's this shift that has occurred.
Yes, for example, the young parents want their babies to sleep throughout the night.
Mhm.
It's not natural. It's impossible. But they believe if they give formula, the baby will sleep throughout the night. But I say it's impossible. It's not the way of the young babies. The young babies are quite natural to wake up many times during nighttime, but they don't know.
Absolutely. I remember having that very conversation with some of my family who did not breastfeed their kids, and they couldn't understand why my babies woke up in the middle of the night to be fed. Oh goodness, that's really interesting. So do you happen to what do you see are the most pressing needs in Japan, or opportunities in Japan, as it relates to breastfeeding medicine and your practice?
Um, uh, So the big issue for me is the decreasing rate of exclusive breastfeeding. So from the public health view, and medical world should promote breastfeeding as an public health issue. And many physicians believe that there is no difference between breastfeeding and bottle feeding, and it is not visible in Japan. Um, the difference between breastfed babies and formula-fed babies, so they are not aware the importance of breastfeeding because the babies in Japan are not dying because of not breastfeeding. So,
Mhm.
um, so the issue is invisible in many um, medical fields. But breastfeeding is a big issue to protect the health of um, our people in all over the world. So not only in low income countries, but also in high income countries where the infant mortality rate is very, very low. I think that Japan is one of the most uh, the lowest mortality rate country in the world. But breastfeeding is also important in Japan. So people should be communicate by government or um, medical organizations such as Japan Pediatric Society or something like that to promote breastfeeding and the importance of um, promote and support and protect breastfeeding.
Is there anything you think that ABM could be doing to help make that more prominent and increase the importance of
The
yeah.
protocol is very useful weapon that I can use, and I some of them are translated, and I can show the translated protocol to our colleagues. So how can we do that with this according to the protocol? So the protocol is most strong uh, weapon for us.
So we need to focus on translating more of the protocols into the native languages. That's wonderful. Okay, that lines up with the priority and the very valid expectation. Um, what keeps you motivated? You've been doing this for more than 40 years, and what keeps you motivated and empowered?
So I think breastfeeding is very interesting to my how do I say? It's scientific, and not only for emotionally or feeling, but the breastfed infants are different from formula-fed infant, and I see the difference, and I recognize the difference. So the breastfeeding is very should be considered as very scientific and very attractive field of science. And it's easy, and there is no no no, no special thing to do that. So it's but for my interest, it is very my scientific curiosity.
That's what research and science, how it gets advanced is from curiosity. So it's wonderful to see you very passionate. Just in what you shared today, I hear everything that you're sharing through passion for breastfeeding medicine, for the science behind breastfeeding medicine. So thank you. Um, is there anything additional that you'd like to share that we haven't discussed?
And when I first attended an ABM meeting in Vancouver, I really thought I found my place, my people. This is the place I should belong to. So there are many like-minded friends across the world, and you can find um, best friends from ABM members. As I am privileged to attend the almost all meetings since 2002, and I could make a lot of best friends, and I have a very um, global network with my breastfeeding friend. So um, there is a barrier for language, but if you can jump into the community, you can find your place, and you can find best friends to understand each other and to support breastfeeding, and we can share our experience. and we can share our passion. And now I think I am going to be retired in several years, but I have many friends all over the world. So that it's very nice to visit the friends in all over the world.
That's wonderful. ABM is more than just a professional organization. You're a group of friends. It's
Yeah,
where to
yeah.
belong. That's wonderful. So that kind of takes us through our question set. Thank you so much, Dr. Sale, for sharing your insights and experience with us today. Conversations like this help us better understand the unique realities of breastfeeding medicine across different regions and remind us of the common challenges and shared values that connect us all. We hope you'll join us for the next episode in our Feeding Forward series as we continue exploring the global landscape of breastfeeding care and advocacy. Until then, thank you for viewing and thank you for all that you do to advance breastfeeding medicine globally.